Thank you everybody for joining. We're just going to wait a couple of minutes and then we'll begin the session. Thank you. Thank you everybody for joining. We're just going to take another minute before we begin the session. Thank you very much. Thank you all for joining us. Good morning, good afternoon and good evening all. Once again, a very warm welcome on behalf of the NYT team. We're very much looking forward to supporting you with today's second annual Health Campaign Effectiveness Coalition meeting, The Promise of Collaborative Action. We would like to open with a few housekeeping notes before handing over to Chris. We are delighted to offer today's session in English, French and Spanish. You will see on the Zoom menu bar the interpretation button. Please select your language now. And for the benefit of our French and Spanish speakers who've already joined us, pour écouter la version française, il faut cliquer sur Interprétation dans les options de la réunion de Zoom et sélectionner le canal français. Y para escuchar la versión española, se puede hacer clic en Interpretación en las opciones de la reunión de Zoom y seleccionar el canal español. So thank you to our interpreters for your support today. Please be aware that the sessions will be recorded and you'll be able to view the recordings post-event via the Health Campaign Effectiveness Coalition's website. And please familiarise yourself with the programme, speakers, attendees and networking opportunities. All of these can be accessed from the left-hand menu bar from the homepage on the meeting platform. So all plenary sessions will take place on the main stage where we are now, and please find your chosen breakout session via the programme tab, and you'll be able to join and watch directly in the platform. You'll also be able to connect directly via the attendees and networking tab, search by name and filters to chat directly, and your replies will appear in your private chats next to the discussion channels. Please also take the time to view the poster presentations, the library, and join the discussions in the discussions tab on the menu. Each poster has a dedicated discussion stream. And again, you can connect directly with the poster presenter by searching on the attendees list. And for networking, we'll be using AirMeet as the Coalition's annual meeting networking platform. So click on the networking session from the programme tab on the platform, and to set up your AirMeet account to join. It only takes a few minutes. You'll then be able to join in conversations on the tables, and these are going to be grouped by themes and poster presentations. We'd like to encourage interaction, so please use the social media channels to promote and engage a wide audience for this event. by tagging @HCE Coalition and using the hashtag collaborative action as well. And during the two-day meeting, please add your questions to the Zoom Q&A, which can be found at the bottom of the Zoom screen. You'll be able to see the questions posted, upvote and add additional comments, as well as ask questions in English, French and Spanish when the interpretation is available. And finally, the MYT team are here to help you with any technical difficulties. Please use the chat facility on Zoom or email the team at events@myt.uk.com. And I'm now delighted to hand over to Chris to welcome you to the meeting. Thank you.
Greetings and welcome to the Health Campaign Effectiveness Coalition meeting. I'm Chris Sarlis. I'm the director of the HCE program at the Task Force for Global Health. We are really excited to see so many people from around the world join us today. We had over 370 individuals register for this meeting. This includes participants from at least 50 countries, representing more than 100 different organizations. This is more than triple the number of participants that we had last year at our first meeting. So I am just so appreciative and overwhelmed. Thank you so much. So for many of you, it sounds like this may be the first time you've ever attended an HCE Coalition event. So let's use this meeting to reach out and meet somebody new. That's what a coalition is about. You can go ahead and add a little bit about yourself in your profile and even directly chat with other attendees. Over the past few years, even before COVID-19 hit our countries and suspended and delayed many critical campaigns and routine health services, country and organizational leaders acknowledged that we could do a better job by working together. We're all here today because we've made that commitment to collaborate. But we know this also means we must work differently. I would like to acknowledge the Bill and Melinda Gates Foundation for providing funding to the Task Force for Global Health so that we could launch this innovative coalition. Last year, when the leadership and design teams formulated the coalition's vision and theory of change, they envisioned a future state where country health systems were stronger and used campaigns strategically and in concert with primary healthcare services to better reach populations in need. If you're new to the coalition, you can find details of the vision and theory of change on the campaigneffectiveness.org website. They also identified 3 strategic approaches for the coalition. First, we needed a means to bring stakeholders together and bridge our program silos. The very fact that I just said we had more than 370 participants for this meeting speaks to the desire to be part of a coalition. It demonstrates that there is interest and commitment in building more intentional collaboration. We've been able to form a very strong governance structure that includes senior leaders from multiple global organizations and countries. I'm grateful for their significant contributions, and you'll hear from several of the leadership team members during tomorrow's plenary. We also have a very diverse and experienced scientific and technical advisory committee, the STAC, and a campaign integration working group. All these groups have convened multiple times over the past year and are contributing to the sessions throughout this meeting. Coordinating a coalition requires a strong and dedicated program office, and I would really like to thank my team for their hard work to launch this program and plan this amazing meeting. And a special note of appreciation to Leah Denise Wyatt, our Senior Associate Coalition Manager, and Sarah Gilbreth, our Communications Manager. They have done an incredible job behind the scenes to pull this meeting together. Thank you. And a shout out to Dr. Kendall Krause, our program's Senior Project Officer at the Bill and Melinda Gates Foundation, for all of her support. The topics that we are talking about in this coalition are really tough, and we know we don't have all the answers. So if we are to be a real learning and action-based coalition, we must also test and evaluate new approaches and create new knowledge. Implementation research is a key component of this program. Based on your input during last year's coalition meeting, the STAT convened to formulate a research and learning agenda to answer these thorny questions. You can find the research questions around these three themes on the campaigneffectiveness.org website. In the past year, we've funded 18 country-based implementation research projects. During the breakout sessions and networking time, you will hear from several of these research teams, as well as from many other countries and organizations who are innovating to develop better campaign practices, tools, and approaches. We're beginning to build out this new hub of knowledge and learning. In addition to the implementation research studies, there are many resources, such as the integration decision guidance tool and the campaign calendar that was developed by our partners at Linksbridge. We invite you to contribute your work to the HCE Coalition site, as well as share these resources with your networks. So, great progress has been made over the past year, but I believe we are now at a pivotal moment with the coalition. In addition to the work that the coalition has done, new strategic plans were launched this year, including the NTD Roadmap 2030, the Immunization Agenda 2030, Gavi 5.0 strategy, and an updated global polio eradication strategy and malaria technical strategy. These are all forward-looking plans and have quite a few things in common. Each and every one of these strategies calls for improved cross-sector and inter-sectoral collaboration. There's a renewed interest in integrated approaches, especially ones that support more alignment with primary health care and strengthen health systems. These strategies also all emphasize the importance of country-led, equitable, and sustainable approaches. And we know this is going to require a slightly different approach from the current one. And finally, we're all recognizing that COVID-19's impact on health systems will continue and even be more demanding in the coming months as countries roll out the new COVID vaccines. So we've often heard the phrase that we must build back better after COVID. This coalition, and that means all of you listening to me, must take the opportunity now to define what that looks like for health campaigns. These new strategies tell us what we should do. This coalition has a unique opportunity to develop and define how to do it. The theme of this meeting is the promise of collaborative action. I've just told you a little bit about what we've accomplished so far over the past year or so, and the different roles the coalition can play. Throughout this meeting, I want you to be thinking about three questions. First of all, what does success look like for you? If we can really do a good job of collaborating and coordinating across our different programs, what would be different in your work, in our communities, in the ways that our programs interact, with our policies and funding for campaigns? And most importantly, what should this coalition focus its efforts on? We need to use this meeting to collectively develop the 2022 HCE Coalition Action Plan. So reflect on these questions while you're engaging in each of the meeting sessions, and we'll have a chance to begin to answer them together in tomorrow's plenary. So you've all seen the meeting agenda, so I just want to point out a few highlights before we get started. So we're starting off this morning for me, in a wonderful plenary. And also we're going to close the meeting tomorrow in a plenary. But the bulk of the time will be spent in technical breakout sessions. We have a total of 9 breakouts, 3 concurrent at a time. And I know it's really hard to choose which ones to attend since all the topics are really interesting and really, really important. So we will be recording all the sessions and sharing the outputs on the campaigneffectiveness.org website the first week of November. During these sessions, I invite all of you to actively engage in a way that works for you. We want this meeting to be interactive, so get your fingers ready to type in the chat and please use the Q&A function. There's also a discussion feature on the event platform for you to weigh in on some of the key areas and questions of common interest. As Debbie mentioned in the housekeeping, we have 2 networking sessions where you can engage in an informal roundtable discussion with our virtual poster presenters. Please check the event site on how to access them on AirMeet. And tomorrow's plenary is critical. It's a chance for you to shape the priorities for the coalition in the coming year. We will share some of the actions that have been noted in the breakouts and ask you to vote on your priorities. And then members of our leadership team will join us in a panel discussion to reflect on those priorities and offer their ideas in our closing session. So please don't miss that. I want to thank all of our session moderators, presenters, poster contributors, and planning team for preparing such an exciting program for us. And thank you for joining us. So let's get started. So I'd like to kick us off with our first panel discussion. We're going to hear next from several country representatives from Nigeria, PAHO, and WHO Afro, who will offer their insights on opportunities to improve collaboration across campaigns and how this coalition can make a difference. I'm honored to have 2 members of our Scientific and Technical Advisory Committee moderate this panel. I'd like to introduce to you Dr. Asma Ali and Dr. Fikreab Kebede. Dr. Ali is a senior public health specialist and polio expert and independent consultant. Previously, she served as a medical officer at the World Health Organization and as a medical team leader in Sierra Leone, Afghanistan, Kenya, Mozambique, Pakistan, and most recently in Somalia. Dr. Kebede is a senior technical advisor for trachoma and neglected tropical diseases at the Ministry of Health in Ethiopia. He has over 30 years of experience in public health and community development programs, and for the past 7 years has dedicated his time exclusively to the control and elimination of NTDs. Dr. Ali, Dr. Kebede, I now hand it over to you. Thank you very much and have a great meeting.
Thank you.
Thank you very much, Christy. And I'm really delighted to welcome our esteemed panelists, 3 remarkable individuals from across the region, countries, and health campaign domains and discipline. I present to you Dr. Bassey. Dr. Bassey is a public health physician and an immunization expert, and is currently the Director of Disease Control and Immunization at the National Primary Healthcare Development Agency headquarters in Ajuba, Nigeria. He's the pioneer program manager of the National Emergency Routine Immunization Coordination Center from 2017 to 2020. The second panelist is joining us from PAHO is Dr. Martha Saboya. Dr. Saboya is currently a neglected infectious disease epidemiologist advisor at the PAHO in Washington, DC, a position occupied since 2017. And previously, she worked as an NID specialist at PAHO from 2010 to 2017. And our third panelist is from WHO Afro, Expanded Special Project for Elimination of Neglected Tropical Diseases, ESPEN, is Dr. Pauline Mwinzi. Dr. Mwinzi is a technical officer for schistosomiasis and other helminthiasis at ESPEN. She has over 20 years experience working in NTD research in Africa. So I will be asking the panelists to reflect on their aspiration and opportunity for campaign collaboration. And after, Dr. Kebede will ask them to share on their opinion on one key action on the coalition to take into upcoming year. So I will start with Dr. Bassey. So Dr. Bassey, what were the forces and factors that made the integration of immunization campaign a success in Nigeria? Over to you, Dr. Bassey.
Thank you so much. I'm privileged to be with this great house. For us in Nigeria, like you said, yes, we've seen success from integrated campaign because this led to the eradication of polio in the country. And it also led to the MNTA elimination in some of the zones. The factors that contributed to this were mainly, one, the establishment of structures and coordination teams that were able to handle this, where at the national, at the state, at the local councils, we have structures that could coordinate what was happening. And then secondly, we also have campaigns that are usually targeted with proper planning, unlike what it used to be in the past. So they are targeted. Once they're targeted, we aim at achieving the target of what the campaign was meant for, and that really helped us a lot. The third factor was the integration of services with the use of pluses. You know, most people will come out for the pluses that they are seeing during the campaigns, and this increased demand in most instances. And then the use of technology for our micro planning, our data collection, and then the analysis has also been very, very useful. For instance, we're using the GIS for our microplan, the ODK, and the rest of it to capture our data and then be able to analyze them. And these were very useful. And also, most importantly, factor that was very useful was the use of data for immediate actions. So once we analyze, have results, see where the issues are, we were able to go out and ensure that interventions were put. So, and in our country also, the improved and integrated monitoring and supervision was very, very useful in our activities. All this helped us, and from these factors that we've seen that was useful in the integrated campaigns, we are also looking towards introducing into the other routine immunization and primary healthcare systems so that we can get more results. Thank you.
Dr. Ali, if you could just put your microphone on, thank you.
Thank you so much, Dr. Bassey. And now we will move to Dr. Matha. And Dr. Matha, we would like to understand from you and understand your aspiration on what were the best possible opportunities in regards to planning and financing of integrated health campaigns that foster strong community engagement as well as help strengthen the health system in PAHO region.
Thank you, Asma. Thank you for inviting me to be part of this important panel.
Dr. Martha, could I just interrupt you just one quick second, please? We just want to refresh the interpretation booths. I won't be a second.
Petit problème de chaîne d'interprétation.
Okay. I'm just checking that's all. I think that's all reactivated, but we just wanted to check it was working okay for everybody. Okay, over to you again to answer the question. Thank you.
Thank you. Dr. Asma, are you going to repeat the question, or can we start the discussion?
Sure, Dr. Matha, we will repeat the question. So the question is around what were the best possible opportunities in regards to planning and financing of the integrated health campaigns that foster strong community engagement as well as help strengthen the health system. Over to you, Dr. Matha.
Thank you, Dr. Asma. Happy to contribute to this discussion in this panel. Countries have in general experience and success stories implementing health campaigns to eliminate several diseases, mainly communicable diseases. And I think that there is a wonderful opportunity for countries to use all the knowledge and the know-how and the capacities from standalone health campaigns to redesign health integrated campaigns to respond to the health needs of the communities in their own contexts. And I think that subnational and local health teams should be the leaders of the bottom-up planning process because they are the ones that know better the realities, needs, and capacities, and especially the gaps at the local level. So in this bottom-up planning process, communities must be actively involved in planning to make sure that cross-campaign collaboration is intentionally designed with a community and people-centered approach as a complementary strategy within the primary healthcare and not only as a parallel strategy. And from this perspective, I think that the domestic health funding should be assigned to support the subnational implementation of health campaigns that are tailored to specific needs and contexts. And in the same idea, the stakeholders and donors should support cross-cutting and cross-campaign collaboration by clearly understanding the needs within each country in which they have some interest and adding efforts to fill the financial and operational gaps that have been already identified at the subnational level. And I think that the main message here is that planning and financing integrated health campaigns is a collaborative exercise in which communities and local health teams are the leaders of the planning process, and the intermediate national and international stakeholders are called to support financially and technically these tailored campaigns to jointly overcome those barriers that are preventing our communities from living healthier. And in that way, we can strengthen the health system. So if we can work together towards this same goal, we will contribute to the Sustainable Development Goals, especially to those objectives related to universal health and well-being. Back to you, Asma.
Thank you so much, Dr. Martha. And we see repeated themes of designing the campaigns as a success with engaging the community, with the plasters from Nigeria. And now we will go into our third panelist aspirations, and we welcome Dr. Pauline Mwinzi. Dr. Pauline, welcome, Dr. Pauline.
Thank you.
So, Dr. Pauline, we would love to hear from you and your aspiration. And our question to you is, most of our health campaigns are funded by different donors, organizations, and guidance is set by global organizations. So what are your aspirations and preferred future for the most collaborative and integrated approach for health campaigns? Over to you, Dr. Pauline.
Thank you very much, and thank you for inviting Aspen to this panel. And thank you for this very important question. Let me start by pointing out the role of the expanded special project for elimination of NTDs, whose focus is to accelerate the elimination of the most prevalent NTDs in Africa that can be addressed by preventive chemotherapy and complemented by hygiene, water, and sanitation through integrated platforms. And thus, we then ensure the elimination targets set out in the NTD Roadmap 2030 are met, working jointly with countries. And secondly, I'll speak to integrated health campaigns and why we think this is more important now than ever. In the past decade, with the help of the Aspen Partnership, 450 million of the 600 million people affected by NTDs in the Africa region could be targeted annually up to 2020. But in recent months, up to 22 national NTD programs have suffered interruptions of financial support, which has also affected our drug delivery program in the region. As a result, the treatment gap has increased from 150 to 350 million people per year, meaning that several hundreds millions of children may not get access to the life-changing treatments, as well as disability preventing surgeries that may not happen if this gap is not urgently addressed. And therefore, the hard-fought progress toward eliminating NTDs in these several African countries is at risk, and the cost of restarting MDAs once stopped may be a lot higher. Now, what is significant is that reduced financial support for NTDs has a broader impact and undermines other efforts to strengthen health systems, enabling pandemic preparedness and reaching the sustainable development goals. And so our dream for a more collaborative and integrated health campaign is to have sustained commitments in supporting NTD elimination programs. And we want to strongly encourage this because NTDs and the responses to them not only have the most direct relevance for the health goal, that is the SDG, the third SDG, but also have wide cross-cutting and cross-sectoral linkages and effects that make them relevant to all of the SDGs. If we do not reach people suffering from NTDs, we will not simply achieve the SDGs. And further, successful interventions against NTDs will contribute to meeting other SDGs, such as alleviating poverty, hunger, enabling people to pursue education, to lead their productive working lives, and promoting equality, for example, with regard to gender. NTD interventions are tied to the wider goals of provision of clean water, sanitation and hygiene, and availability of the resilient infrastructure, which is in Goal 9, should facilitate the delivery of medicines and outreach to remote communities. And thus, other goals of sustainable cities and climate action also come in to support the environmental management that is necessary for control of the disease vectors. And therefore, attaining all of the SDGs and NTD goals are all founded on strong global partnerships. Thus, it should be in the interest of the global community to sustain investments that directly impact the health and poverty alleviation of vulnerable communities. And at this point, we want to thank all the partners who are currently discussing with us at WHO on filling the urgent gaps and conducting analysis on the funding, on these funding gaps following these recent changes and interruptions to funding. The last point I want to make is on the other reason why NTD should be at the center of our health integration campaign, and it's their contribution to the universal health coverage agenda and pandemic preparedness. The notion of equity, which is a central element of the global NTD agenda, and in many instances, NTD programs are leading the efforts to ensure that key interventions reach those who need them most, particularly communities in remote areas and beyond the reach of most health systems. Therefore, supporting NTD intervention programs will contribute to pandemic preparedness, improve the regional cooperation, strengthen the African-based public health capacity, help vulnerable communities to stay healthy, and reach people beyond the formal health systems, as well as reducing the spread of COVID-19. Noting that only about less than 1% of global healthcare funding goes to controlling NTDs. But the truth of the matter is that by investing in NTDs, we can make massive strides against both NTDs and other problems that share the same origins. And therefore, investing in NTDs is hugely beneficial. It can help improve health conditions, strengthen health systems on the continent, and advance sustainable development across Africa. I want to conclude by reiterating that we have the tools, we have the drugs, we have the data. And so when we talk about health integration, then NTDs are a winning starting point. Thank you, and back to you.
Thank you very much, Dr. Pauline, this was amazing, and how you describe the importance of financing and the collaboration across the NTDs as a starting point. I will now hand over to Dr. Fikreab, who would take the panelists to the next session of questions. Thank you so much, everyone.
Thank you, Asma, and thank you again, all our panelists. And really, this is very exciting discussion. May I ask our panelists to turn on your videos, please? Yeah. So we heard from the panelists clear and loud that success factors include setting a coordination mechanism from the outset, and the use of technology, and also real-time data for immediate action. And also we heard that the cross-campaign collaboration is the responsibility for all stakeholders, and where the communities and local health teams sit on the planning and implementation process starting from the outset. I think that's very important, and we heard clear and loud that funding resources are really very, very important and crucial and critical also to sustain the gains that we got in the past. So sustained commitment is very important, while also strengthening the health system and health preparedness and resilience system establishing at country level is very important. So I will going to ask each of our panelists to take no more than 2 minutes each to share your opinion on what role or action could the coalition take to support these opportunities that you just mentioned. Maybe we can start with Dr. Pauline, then Dr. Marta, and Dr. Bassey, in that order.
Yeah, thank you. Thank you very much, Dr. Kebede, for this very important question. I want to point out 3 areas in which I think the coalition could support. And the first one is a campaign for integration of NTDs into global health and development. And here we think the coalition could advocate for a more integration of NTDs into global health and development agenda as a proper initiative on a massive scale. The control of NTDs has much to offer in an agenda that makes poverty alleviation its overarching objective and aims to leave no one behind. In addition, examining and advising on the impact of existing incentive structures among different campaign donors and stakeholders on campaign outcomes and the impact on the health systems. And I would like to point out another point on prioritization of prevention and control of NTDs in the national health plans. And we, at the moment, are working on the 3rd generation national health plans in the African regions. Countries are both the drivers and the beneficiaries of progress towards the 2030 NTD targets. And the coalition could help towards supporting campaigns for countries to integrate and prioritize prevention and control of endemic NTDs in national health plans, and dedicate corresponding line items in national health budget. Multi-sectoral action must be fostered and planned well in advance at ministerial and higher levels in order to build such high-level political will that is required for NTD plans. And the last point I want to make is campaigning for closing the treatment gap. And as I mentioned earlier in my earlier remarks, I mentioned how in the past decade we've collectively reached every year over 450 million people out of the 600 million that require interventions in the African region. But with funding shifting towards health emergencies, more than 150 million may miss out on MDAs, for example. And so investments from international and domestic donors are urgently needed to close the treatment gap and eliminate NTDs. The support of the Health Campaign Effectiveness Coalition will be very much needed to mobilize more investments to both national and international levels, and for a more integrated NTD prevention and control campaign, both nationally, regionally, and as well as globally. Thank you. Back to you.
Thank you, Pauline. Dr. Marta, please.
Thank you, Dr. Kebede. And I totally agree with Pauline highlights regarding your question. And I think that the coalition can also actively and loudly advocate with partners and donors to shift from a focus on funding standalone health campaigns to a focus on supporting and funding integrated health campaigns that are tailored to the specific needs and context of the communities affected by several health problems that are the result of a combination of multiple factors. And I think that we need to use every single opportunity we have to offer communities integrated packages of interventions to respond to the specific health issues they suffer. And I already saw a question in the chat and answered the chat for questions and answers from Obina Everin, that she is asking about how we can integrate campaigns in the outbreaks perspective. And that is precisely the message here. We need to use every single opportunity to offer integrated packages to those communities that perhaps that is the only way that they are going to receive it. And I hope we can progressively and actively and quickly change from campaigns that are planned and funded to target one or two problems to campaigns that are intentionally organized and funded to respond to the health needs of people and communities. And I think that the second opportunity for the coalition in the upcoming years is that the coalition should involve civil society representatives in the working groups and in the leadership team to make sure that they have their voices heard loudly and that they can actively participate to make cross-campaigns collaborations a reality. Several standalone campaigns have been able to involve civil society in the last decades in the efforts such as the elimination of tuberculosis, the elimination of malaria, the elimination of leprosy, and many others. So I think that we can identify them, involve them in the coalition, and make the coalition stronger and inclusive. Back to you, Dr. Kebede.
Thank you, Dr. Martha again. Dr. Bassey.
Okay, thank you. From my end, I just want to mention that I don't think campaign always is sustainable. If the health system was strong, the routine services are perfect, optimal, we will not be conducting campaigns. So we want the coalition to continue to help countries, Nigeria and others, to see how we can strengthen our health system, make the routine services optimal, and reduce campaigns because it's not sustainable. And secondly, we want to thank all our partners who've been supporting Nigeria and other countries, our donors, partners from the Gavi that are here, WHO, UNICEF, Bill, Melinda Gates, CDC, USAID, all that I cannot finish mentioning all. At this trying time for countries like us, you've been there to help us to plan. We want to plead with the coalition to continue to work with these donors, partners, bring them together to ensure that they support countries for more sustainable services so that we can transit out from this campaign mode to having services that are optimal and will save cost and more efficient for management. Thank you. Back to you.
Thank you again, Dr. Bassey and all our panelists. Yes, I think we have to work with the health system that should be strengthened. The other thing is also, it is community development, it's communities' health. So everything that we are doing, not only in health campaigns, but the whole SCDG, all development, they have to be centered. Communities should be at the center of what we are doing. So collaboration, especially with resource limited, we need that one for collaboration, and not only within the health system, but also with the other stakeholders as well. And it's good that we have to start now mainstreaming of campaigns so that they will be sustained and they will be part and parcel of the health system. We have a few minutes. If there is any question, I don't see. Yes, there is one question. How can we promote reaching more people in the IDPs to this program, health campaigns? Anyone who wants to take that one? How can we reach to IDPs?
Perhaps maybe I would come in, Dr. Fikreab.
Yes,
I think
please, Asma.
the message from Dr. Martha was very strong in a way that the vulnerable population themselves need to be engaged in designing these health campaigns. And I think once we have the IDPs also engage in designing this type of activities and the campaigns and understanding their needs, I think then we are going to be reaching more of them and actually reaching with the needs of themselves and not only designing for IDPs from outside. And this is, I think, one of the most important message we can pass across is including the community and the vulnerable population in designing our campaigns. Over from my side.
Thank you, Asma, for that compliment. There is two questions on the question and answer chat. Yeah, how and when do we say services are integrated? Do we have a matrix to quantify this across the planning and implementation cycle? That was asked by Mr. Ziraba. And there is also another one. How do we integrate campaigns in response to disease outbreak, specifically in country regions? So one is for outbreaks, and the other is how can we integrate services? Anyone would like to take that one? Maybe Dr. Bassey? You're a country experience that way.
Thank you. I think we are doing a lot of this currently with the support we are having from Gavi, WHO, UNICEF, the Minister of Health, and all our other partners who are working with us. We are already doing a lot of that. For instance, we know there are some areas that are prone to outbreaks, measles, and the rest of it, where we need to do some campaigns before the peak period for measles. The COVID is on. There are also areas we are targeting for MNT and elimination and the rest. This last quarter of the year, what we are doing is bringing in all those activities together, integrated, so that it's not the same health worker, the same community, you are going with different approaches. So the support we've had from our partners has been very, very helpful in this direction. And what we have seen is saves time. We are using integrated approach, and it saves resources. And then the results are much, much more better. And of course, the issue of tiredness, the fatigue of the health workers is taken out of it. So we have seen using the integrated approach is much, much, much more efficient, and we are bringing it into our health system. And we also use, beyond these other campaigns that we are conducting, use the opportunity to also offer RI to our children. So that is the approach we are using with the support we are having from our partners. And so far, it's been very useful. Over.
Yeah, thank you. Yeah, Dr. Marta, there is one question. You mentioned about integrated health package tailored to the needs of particular countries or communities. So Patrick is asking you, can you give us some example what this package looks like and what it contains? Marta,
yeah,
please.
Definitely. And thank you, Patrick, for that question. And I will give you an example. I work mostly on neglected tropical diseases. So a country that has many populations in the Amazon basin was trying to reach those communities to identify trachoma cases, to see if trachoma is a public health problem there. But then they realized that in this same area, they have malaria, pregnant women that didn't have any access to health services, they have leishmaniasis, they have tuberculosis, and they have many dermatologic problems. So they decided that by using the unique opportunity of trachoma, with the funding of trachoma, they put additional resources, more people in the health team that was planned to reach the communities for trachoma. They brought more medicines according to the epidemiological profile of those communities and the problems that they already know based on the health local teams. And so they organized the entire activity for trachoma, plus many other problems that were already known affecting the same communities. And that was a success because in that specific area that is in the border between two countries, people didn't receive health services for the last 2 to 3 years. So that was the unique opportunity to bring them integrated packages. So every time we have an opportunity to reach them for malaria, for tuberculosis, for HIV, for NTDs, we should be able to say, wait a moment, what are the problems in these communities? What else we can bring them to integrate packages? And I understand the message of Dr. Bassey that we cannot sustain campaigns, but I think that we should see campaigns as a strategy to complement the health services, because in some areas we cannot offer in every community health services. So we need to be strategic and combine the different options that we have to bring integrated packages to the communities according to the context and the epidemiological situation. Back to you, Dr. Kebede.
Yeah, thank you, Marta, again. Maybe there is one in the chat box. Maybe I will give that one to Pauline to intervene. Do the health campaign planning engage local communities?
Thank you, and I think that's a very important question because, of course, we can appreciate the challenge there. It must take a lot of effort to get to the level of the communities, but we have to understand that the interventions are meant for the community, and therefore the planning should start from there with the communities and understanding them and their needs and using the information from the communities to be able to tailor the rollout of the interventions that we are bringing to them. Of course, the wider understanding of what communities are where and mapping them out, should be able to be done at the national level, understanding where the non-bandit communities are, where the IDPs are, but then planning to be able to get to the front line at the community level and be able to engage them ahead of interventions. If we are to expect high-level coverages. And this really has to be integrated in all of the planning. WHO has tools for macro planning, and it's at this level that we have to bring for the communities, their representatives, and be able to understand them better and involve them. Thank you.
Thank you, Pauline, and thank you all our panelists for your time and sharing your wisdom. And I would like to the audience also for your participation. That's our appreciation for your contribution as well as to the discussion. But there will be more breakout sessions, so that will give also some more time to generate more ideas. And I would like to thank on behalf of myself and Asma for giving us this opportunity to moderate this session. Thank you again. Over to you, MIT team. Thank you. Bye.
Thank you, Dr. Ali and Dr. Kebede. So on behalf of the MIT events team, it's been our pleasure to support you for this opening session. As Chris mentioned, please join us at our next sessions. We've got session A, decision support for campaign integration. Session B, taking promising practices for microplanning to the ground. Session C, developing campaign effectiveness outcome measures. So all you need to do is go back to the homepage, click on the program tab to choose your session and join the meeting. So our next sessions will begin at 0900 EDT after a short 10-minute break. So thank you once again to all of our speakers and to everyone for joining us. We'll just now end this session. Thank you.